Hi, I'm Dr. Chad Larson. Although we're concerned about lots of other health conditions like Alzheimer's and cancer, cardiovascular disease is still unfortunately the number one killer. And that's in women as well. A lot of people, I think, associate coronary artery disease or heart disease with men, but guess what? It's the number one killer of women as well. And women, I think, for the most part, are more concerned about breast cancer. It's one that more often than not comes up when I'm, doing an evaluation on a female patient, and they, say, okay, one of my health goals is to prevent breast cancer, and so what can we do to prevent breast cancer? And we'll talk about that, but I think I need to hear, or wish I heard more, that women are interested in preventing coronary artery disease, because that's actually the number one killer. And so I think we need to do better about getting that concept out and educating women on the risk factors for cardiovascular disease, because that's the thing. That's the one that is still number one. We still need to be concerned about the other health conditions, of course, but we have to have a stronger educational effort towards coronary artery disease. And so there's a really interesting study that was just published that I want to report on, and it goes in alignment with some things that I've reported on in the past. And what they did is they evaluated risk factors for obstructive coronary artery disease, heart disease. This is the kind of heart disease that kills people. And so they wanted to evaluate certain risk factors, and they specifically wanted to evaluate obesity compared to body fat. In other words, kind of, is it just body weight that women have to be concerned about as a risk factor for coronary artery disease, or is it a certain type of distribution of fat in the body? And what they looked at is they looked at the BMI, the body mass index, which we've talked about many times, as not a very sophisticated measurement of body composition. There's other more sophisticated ones, and the one that they evaluated to compare what's a greater risk factor is visceral adipose tissue, truncal obesity, belly fat. That's the type of weight accumulation of body composition that increases risk factor for coronary artery disease. So they evaluated that. They looked at over 700 menopausal women, and it's the menopausal women that are more at risk factor for coronary artery disease. We know that estrogen has kind of a reduced, kind of a buffering effect on coronary artery disease, and we won't go into on this particular episode why that is. But as women go into menopause, their risk factor for coronary artery disease goes up higher. And so they wanted to evaluate obesity and use these different measurements to really figure out which one is truly a more specific risk factor for developing coronary artery disease. So they looked at over 700 postmenopausal women, and what they found out is that waist circumference is a greater, actually a significantly greater risk factor for coronary artery disease than the BMI. Because what that really indicates is that overall obesity, like obesity kind of fat stored in multiple body regions, which certainly increases a woman's BMI, is not as significant of a risk factor as truncal obesity, that visceral body fat, that adipose tissue that accumulates in the abdominal section. In this article, they called it lipotoxic android truncal fat mass is what they called it, but it's belly fat. And the study was just published, and so actually online I couldn't get the full study, which I would rather have the full text copy to all pages of the study. This time I was only able to have the abstract, but the abstract gave me enough information, but there's a couple of details that I'm still interested in, and one of them is how they evaluated the visceral adipose tissue, the belly fat. Was it, did they do an MRI? Did they do a DEXA scan, or did they just do a simple kind of, flexible tape measure kind of measurement? This is one that I do in my office all the time. It's extremely reliable, but there are the more sophisticated ones. I've done, group kind of fat burning sessions where we have a truck actually come in that has either a DEXA scan or one of these more sophisticated scans. But just a good old-fashioned flexible tape measure is an excellent way. You just measure around the level of the belly button, and with a kind of a soft, relaxed belly, and that's a great way to track a person's progress. So this was a significant risk factor, much more so than the BMI. So the way that we do it, and they didn't really talk about in this study, but a very simple way to evaluate, and other studies confirm this, is the waist to height ratio. So you take the circumference of your waist and you take the length of your height and you just divide them. And so you want your waist to be less than half the length of your height. So when you do that ratio, it should be less than 0.5. So if it comes out to 0.52 or 0.55 or anything above 0.5, that means that there is truncal obesity. That means that your waist circumference is at this higher risk factor for developing coronary artery disease. And so that leads me into another study. And by the way, that first study was published in a medical journal called Menopause, and it was literally just hours ago, really. And this other study, which they weren't like coupled together, but when I looked at both of them together, there's a connection that I thought would be good to kind of pair together in this discussion. Because if there is truncal obesity, if there is an excessive amount of visceral adipose tissue, that begs the question, like, okay, what do I do about that? And what you do about that is something that we've talked about before, but it's really nice to read this confirmation in the study. And the study was just published today, actually, in a journal called Cell Metabolism. And they wanted to evaluate fasting. And fasting, there's no faster way to cause the body to drop insulin, which we've talked about many times, the importance of dropping insulin if fat burning is one of the goals. And insulin and other hormones are kind of the gatekeepers of fat burning. And the lower the insulin, kind of the greater the fat burning hormones come out and do their thing. The higher the insulin, the more that the fat burning hormones are kind of on vacation and not able to mobilize fat, especially that stubborn visceral adipose tissue, the belly fat, like we just talked about in that other study. And so they looked at fasting. In this particular study, they used a certain type of alternate day fasting, which basically looks like this. They took two groups. One group just ate normally. That was sort of the control group. And then they had the group that was being tested with alternate daily fasting. And basically, it's a fasting period for 36 hours. And then there's an eating period for 24 hours. So 36, 24, 36, 24. And this was a 4-week study. And they wanted to kind of compare that to caloric restriction. And caloric restriction is where you take a certain reduction of overall calories on a daily basis. And that comes with some issues that make it less sustainable for most people. It drops your metabolism, and so it requires more and more kind of fat burning activities to try to stoke the furnace in the system to burn more body fat. So fasting, just straight up fasting, has become a more popular, and the studies are kind of justifying that it's another way, and some are suggesting, and certainly the study suggests, that it's a better way to burn body fat. Because when you just have caloric restriction, you never cause the body to go, you never cause certain hormones to work in such a way where they really go into kind of self-cleaning and fat burning mode to the degree that I think people need when they have this kind of visceral adipose tissue. And so what they did is this 36-hour on fasting, 12 hours of an eating window, alternating for 4 weeks. And there was, at the end of the study, there's a really significant difference in body fat composition. and significant fat burning, not just a weight drop, and that's important, but a significant amount of fat burning at visceral adipose tissue. So kind of how do we prevent, or how do we mitigate the risk factor for coronary artery disease if a person does have an increased amount of this visceral adipose tissue? And one of the things that you can do is do this, some type of alternate fasting. You can do a daily 18-hour fast or 16-hour fast or 10 or 12-hour fast. The best fast is the one that a person is going to be most compliant with. This one is a little bit more aggressive, going 36 hours of fasting and then 12 hours of eating. That's a little bit more aggressive than what I typically recommend is unless somebody has really, uncontrolled obesity or type 2 diabetes or something like that. Then we kind of just start with an easier type of fast that people can kind of weave into their day a little bit easier without a whole lot of challenge and potential side effect. But the study was interesting and clearly showed a significant amount of fat burning, but there's lots of other interesting effects that they found that you don't get in just a calorically restricted diet. First of all, you get a significant release of ketones. We've talked about ketones many times, and the importance and the health value of being in a state of ketosis, even if it's cyclical. You don't have to be in a constant state of ketosis to get some of these benefits, but they definitely provide a certain pretty significant list of longevity promoting effects, let's say. And many of these have to do with anti-inflammation. And if we can bring inflammation down, then that really helps to mitigate some of these chronic diseases that people are suffering from. And you're only going to get this when you're in that kind of restricted food state. And guess what? This is absolutely weaved into our DNA. There's been multiple generations for as long as humans have been around that the body's well adapted for times of food scarcity, times of low food consumption. And the body has this mechanism that is just dormant basically in our culture that is allowed to come out during these fasting periods. And it has some really great anti-inflammatory effects. It has this effect that we call autophagy, which we've talked about, which is kind of a self-cleansing kind of process. And then, of course, the significant decrease of insulin and the significant increase of the fat-burning hormones. So you put all this together, and it's well beyond just fat burning. You get all these other kind of changes in genetic expression. It's an impressive list of things that change, and they talk about some of these things in this particular study in cell metabolism. It's fascinating. So keep educating yourself on these different types of fast. As the studies come out, which they are pretty quickly, a lot of researchers are getting interested in the effects of different types of intermittent fasting, and I'll keep reading those studies and bringing you the information. Hope that was helpful. Hopefully you learned something. Until then, keep it real.